wish I knew how to throw a ball. I'm getting so frustrated. Why can't someone teach me? Whoa, who are you? I am the throwing fairy, and I noticed your struggles with throwing a ball, so I'm here to help you. Can you really do that? I didn't know you existed. Yes, I'm real, and I'm ready to help you and teach you how to throw a ball properly. But first, you need to learn some more things about your anatomy before you can start throwing a ball. So let's head to the classroom.
I'm outside the classroom where the throwing fairy is informing the students how to throw a ball properly. Let's take a look. What have you girls learned so far?
We've learned the joints, the synovial types, the degrees of freedom, and the motions. So let's start with the shoulder girdle.
The shoulder girdle has a sternoclavicular joint and a acromioclavicular joint, and the two joints are plane. There are 3 degrees of freedom, allowing elevation, depression, protraction, retraction, upward rotation, downward rotation.
The next joint is a shoulder joint. Ball and socket with 3 degrees of freedom, allowing flexion, extension, hyperextension, abduction, adduction, horizontal abduction, horizontal adduction, medial rotation, and lateral rotation.
Then there's the elbow joint, which is a hinge joint with 1 degree of freedom, allowing flexion and extension.
The next joint is the forearm, which is a pivot joint, with 1 degree of freedom, allowing pronation and supination.
The next joint is the wrist, which is a condyloid joint with 2 degrees of freedom, allowing flexion, extension, radial deviation, ulnar deviation.
The next joint is the thumb. In the CMC, it's a saddle joint with allowing 3 degrees of freedom, allowing flexion, extension, abduction, adduction, opposition, and reposition. In the MCP, it's a hinge joint with 1 degree of freedom, allowing flexion and extension. In the IP joint, it's a hinge joint allowing 1 degree of freedom with flexion and extension.
The next joint is the fingers. There are multiple types of synovial joints, starting with the CMC as a planar joint, the MCP as a condyloid joint, allowing flexion, extension, abduction, adduction, and the DIP and PIP joints are both flexion and extension. Don't you have to know the contraction type?
What is a contraction type?
A concentric type is when your muscle shortens and you're going against gravity. An eccentric contraction type is when your muscle lengthens and you're going with gravity, while isometric contraction type is when your muscle stays the same length while the muscle tension changes.
Wow, we've learned a lot so far, but how's this going to help us with throwing a ball? Since we just learned all the joint motions, all we have left to learn are the muscles. After learning all that information, we'll be able to apply this all back to throwing a ball. So let's hit the field. By the end of the session, you'll be able to catch and throw a ball just like me. Let me show you how it's done. Phase 1 is catching a ball above the head. The starting position for this phase is the get ready position. The shoulder girdle is protracted. The shoulder is flexed and abducted. The elbow is flexed. The forearm is supinated. The wrist is flexed. The thumb is abducted. And the fingers are flexed. Phase 1, catching the ball above the head. By the end of phase 1, you have caught the ball above your head. All of the joints are concentrically contracting, except for the fingers, which are isometrically contracting, as the motion hasn't changed since the starting position. The shoulder girdle is elevated through the upper trapezius, levator scapula, and the rhomboids. It is upwardly rotating through the upper and lower trapezius and the serratus anterior. It is protracted through the serratus anterior and the pectoralis minor. The shoulder is flexed through the anterior deltoid. It is abducted through the deltoid and the supraspinatus. The elbow is extended through the triceps brachii. The forearm is pronated through the pronator teres and the pronator quadratus. The wrist is extended through the extensor carpi radialis longus, the extensor carpi radialis brevis, and the extensor carpi ulnaris. The thumb is opposed through the opponent's pollicus. The fingers are flexed through the flexor digitorum superficialis and the flexor digitorum profundus. Phase 2 is bringing the ball to chest level.
The starting position for phase 2 is the same as the ending position of phase 1. The shoulder girdle is eccentrically contracting by bringing the ball slowly to chest level. The motion depression is created by the upper trapezius, levator scapula, and rhomboids. The motion downward rotation is created by the upper and lower trapezius and the serratus anterior. Protraction is created by an isometric contraction because the motion is not changed from the starting position. The prime movers to this are the serratus anterior and the pectoralis minor. The shoulder is eccentrically contracting by bringing the ball to chest level. Extension is created by the anterior deltoid. The elbow is also eccentrically contracting by bringing the ball to chest level. Flexion is created by biceps brachii, brachioradialis, and the brachialis muscle. The forearm, wrist, thumb, and fingers are all isometrically contracting because the motion has not changed from the starting position. The forearm is in pronation through the pronator teres and pronator quadratus. The wrist is in extension through the extensor carpi radialis and ulnaris and the extensor carpi radialis brevis. The thumb is opposed by use of the opponent's pollicis, and the fingers are in flexion by use of the flexor digitorum superficialis and profundus.
Phase 3 is winding up the ball. The starting position for phase 3 is the same as the ending position in phase 2. The shoulder girdle joint is concentrically contracting using upward rotation of the upper and lower trapezius and serratus anterior, as well as retraction using middle trapezius and rhomboids. The shoulder joint is concentrically contracting using horizontal abduction using posterior deltoid, infraspinatus, and teres minor. The elbow, forearm, wrist, thumb, and fingers are all isometric contractions because the motions hasn't changed from the starting position. The elbow is in flexion using the biceps brachii, brachioradialis, and brachialis. The forearm is in pronation using the pronator teres and pronator quadratus. The wrist is in extension using the extensor carpi radialis, brevis, and ulnaris. The thumb is in opposition using the opponent's pollicis. The fingers are flexed using the flexor digitorum superficialis and profundus.
Phase 4 is throwing the ball. The starting position for phase 4 is the same as the ending position for phase 3. All of the joints are concentrically contracting, except for the forearm, as we are not trying to slow down the motion. The forearm is isometrically contracting, as it hasn't changed since the starting position. The shoulder girdle is downwardly rotating through the rhomboids, levator scapula, and pectoralis minor. The shoulder girdle is also protracted through the serratus anterior and pectoralis minor. The shoulder is flexed through the anterior deltoid. The shoulder is also horizontally adducted through the anterior deltoid and pectoralis major. The elbow is extended through the triceps brachii. The forearm is pronated through the pronator teres and the pronator quadratus. The wrist is flexed through the flexor carpi radialis and the flexor carpi ulnaris. The thumb is in reposition through the abductor pollicus longus and brevis and the extensor pollicus longus and brevis. The fingers are extended through the extensor digitorum, extensor indicis, and extensor digiti minimi.
You guys think you're ready to try it all the way through?
Yeah, I think we're ready.
Well then get ready.